you really want to help someone, one of the first things you have to do is listen.
Communication is the thing. We don't get to know enough. We might get snippets on the television, but we don't get to know enough.
I feel myself that if I've got a health problem, I have to have some input to help to cure that health problem.
We are changing. We're not there yet. We're a long way from here.
I have seen things change, and it's only because not only me but a lot of other people will stand up and say, and if you don't stand up and say what you feel, nothing will ever happen.
I think they do take notice of people's opinions.
But it's not just about listening to opinions, it's about doing something about them and then feeding back what you've done.
It's a very good day. They all listen. Something gets done, that comes out of it. Something concrete comes out of it.
Have you got any ideas? Yeah, and also when I look at
in the group earlier, it was lovely to hear people having their say, and you know, without going on about themselves, they were looking at the bigger picture.
Right throughout the borough of Knowsley, the community are involved all the way through, and they're encouraged to take part.
The key thing for me from today's commissioning conference is listening to local people and then going away from this meeting and changing how we commission services. So not just listening, writing a report, but genuinely going away from today and changing the way that we commission and deliver services.
You get to help a lot of mums, that's what I love about it.
I only go to clinic every 2 weeks, so if you've got things in between, you don't want to go to the doctors and you feel like you're mithering, so with having like the leaders here, we can always ask them a question if, you know, what do you think about this, and they always give us their advice, and then we go and try it and then come back next week and say, oh yeah, that worked.
When you come to these groups, you find out about other sessions that are running as well and other things that are going on, so it's brilliant. The midwife told me and the health visitor told me, and then you can go online or you can get leaflets for all the different areas, and that's got all the sessions in it.
These centres are absolutely fabulous, they're amazing, and to be involved in them is like a privilege because it's getting more into the community, so it's easier for the mums.
Nationally, leisure and cultural services are seen as playing a major part in contributing to health improvement. Well, in Knowsley we have a fairly well integrated approach to providing leisure and cultural services to support health and wellbeing, and our partnership is probably one, if not the strongest partnership in the country. In the centre of Huyton, we're building our first leisure and cultural park, which will see £21 million invested in leisure and youth facilities. On the back of the last couple of years working with colleagues within social care, where we've been able to integrate daycare services within our existing facilities in Kirby and Halewood, we're now designing in specialist daycare provision within this complex. Attached to the building is a new youth facility. That will be fully integrated as well, and we're just now working on phase 2, which is looking at the open space which links the new leisure and youth facilities with one of our existing centres for learning, which is a specialist sport and arts college. And so we're trying to form a campus of activity, fully integrated and accessible for all.
Part of the thinking with public-based commissioning was that if we're going to devise service for people who live locally, then it's important to know how they feel about those services and how they want to use those services and how they think it will work better for them. They've been involved right from the beginning and up to the end even the procurement stage, the patient representative was on the group, on the panel that interviewed the providers of the service.
I was interviewing the people who were hoping to win a huge service. These are professionals, senior, I imagine, director level in health authorities and service providers, and questioning them on the same level, and having to be given a response that was meaningful. You couldn't be brushed off.
We don't want wastage in the system. We want people to actually use the system. There's no point having a shining building somewhere where nobody goes to. But if the patients are involved with the beginning of the designing of the building, for instance, they choose the colors, they choose the chairs that they want to sit on. I mean, they get the ownership, because after all, it's our NHS. It's for everybody. And so the patients actually, I'm a patient myself, so when I want to use a service, I want a service that will work for me. Not as a doctor, but as a patient. And so patients will always come first.
The most important thing today was the people's voice. The people were telling primary care trusts what they wanted, the services that they wanted, and how to improve the good services that we've got at the moment.